The U.S. healthcare system has been the subject of much criticism. Some have described it as a miserable failure, claiming that the state of U.S. healthcare is catastrophic. The price we pay is often mentioned, as was the case in the Time article, which notes how healthcare spending in the U.S. is roughly twice that of other high-income nations, but all that extra money isn't leading to better health outcomes. Reuters also echoes this point, noting that the U.S. spends about twice what other high-income nations do on healthcare, but has the lowest life expectancy and the highest infant mortality rates, according to a new study. Others point out how the U.S. is an outlier, noting that the U.S. is the only wealthy country without universal healthcare. All this is happening amidst charges of corruption within the healthcare industry. Healthcare is a topic that should be important to all of us, and the future of healthcare in the U.S. appears to be unpredictable. In 2010, President Obama signed into effect the Affordable Care Act. Such was intended to decrease the number of people who do not have insurance. It sought to accomplish this through a number of measures, which included mandating that everyone have some healthcare coverage, preventing insurance companies from turning away people who have pre-existing medical conditions, making insurance more affordable for low-income people through government subsidies, and instating a penalty for those who do not have health insurance. Although many have spoken highly of how the policy has benefited them, it has also received a lot of criticism. Some of the opposition has come from the current administration, with President Trump claiming during his campaign that he would repeal and replace the Affordable Care Act with something terrific. In December 2017, Trump signed a tax bill that removed the Affordable Care Act's individual mandate that required people to have health insurance. More recently, the Trump administration has said that the entirety of the Affordable Care Act should be struck down in the courts. Although a lot of criticism has come from Republicans, there has also been a new wave of alternative healthcare proposals from Democrats which, whether explicitly or implicitly, suggest that the Affordable Care Act has been ineffective or is suboptimal. One article by Vox covers the various proposals on the table. It notes that there are currently more than half a dozen proposals in Congress, which all envision very different healthcare systems. There do, however, appear to be some common themes in these plans. The authors note that these plans are similar in that they envision more Americans enrolling in public health plans. They would all give the government a greater role in everything, from setting health prices to deciding what benefits get included in an insurance plan. With that said, differences do exist when it comes to things like which public health program to expand and how aggressively to extend the reach of government. Some would completely eliminate private health insurance, moving all Americans to government-run coverage, whereas others still see a role for companies providing coverage to workers. Some bills require significant tax increases to pay for the expansion of benefits, while others ask those signing up for government insurance to pay the costs. An approach that's received a considerable amount of attention is referred to as Medicare for All. One advocate is Bernie Sanders, who, earlier this month, introduced a new Medicare for All bill that would create a government-run system to provide health insurance for all Americans. Such would go further than a former proposal of his, in that it would also include long-term care for people with disabilities. A number of characteristics are noted by CNBC. For example, it covers primary and preventive care, prescription drugs, dental and vision care, mental health and substance abuse treatment, as well as maternity, newborn, and long-term care through a government-run plan. It also lets Americans see any doctor they want to with no deductibles or copays. Additionally, it effectively ends the private health insurance market. Prior to this, House Democrats introduced a plan to insure all Americans through Medicare in late February, which focused on providing a government-funded health care program that would do away with copays, premiums, and deductibles, all the while covering drugs, vision, dental, mental health, substance abuse, and maternal care. It would also provide universal coverage for long-term care for people with disabilities. The support these types of proposals have received from some Democrat presidential candidates suggests that the ideas are becoming more mainstream. As NPR puts it, Medicare for All, once widely considered a fringe proposal for providing health care in the U.S., is getting more popular. Politico even suggested that Medicare for All has become a litmus test for 2020 candidates. Unsurprisingly, the growing popularity of this approach has given rise to a significant amount of debate. In this video, I'll discuss some of the different ways in which this topic has been covered, and then highlight some key issues worth considering. I want to be clear at the outset that this topic is extremely complicated, in part because of how the US healthcare system is structured. As a result, what I'll say is extremely limited in its scope. With that said, hopefully it will at least offer a way for people to get a better sense of some of the topics that arise when different media outlets discuss the topic of healthcare. It may be worthwhile to remember that a handful of different Medicare for All proposals have been made, and different versions may be referenced throughout the article. Nevertheless, I still think that the general points that are raised tend to apply across the board. Fox News was largely critical of this type of a proposal. One article focused on how it was portrayed. While describing Sanders as a self-proclaimed socialist, the author adds that, in his most recent version of Medicare for All, Sanders has found a way to expand his proposal even more to the left. Yet, in spite of it being called Medicare for All, it's noted that one should ask how much of Medicare is really in these plans. In researching the Sanders plan, one might find that there's very little Medicare at all. As a matter of fact, as it relates to Medicare, it's about marketing more than mechanics. This line of thought seems to suggest that what comes to mind when one hears the phrase Medicare for All may be quite different from what the proposal actually contains. What this implies is that the name may have been chosen, in part, by what will be most attractive to the public. It can also serve as a reminder that we should assess policies based on things like their content, values, and impact, rather than on what their name brings to mind. The article moves on to discuss some concerning aspects of Sanders' plan. The first is that it removes options. Instead of choices, Americans will be offered one-size-fits-all coverage. It also cautions against the misleading impression that labeling this as free healthcare can create. Sure, the thought of getting all these things for free may sound good to the uninformed reader. But as most economists will tell you, everything costs something. There is no such thing as free. The author quotes Sanders as calling his policy a matter of principle, and appears to portray him as failing to acknowledge economic realities. This then leads to a section on the cost of this plan, with its high price tag emphasized. This will inevitably lead to higher taxes, which will impact more than just the rich, in spite of what some people may say. As the author puts it, sure, the left can claim that they will only tax the rich, but let's be real. When it comes to new taxes, it's the middle class that suffers. The policy is also portrayed as producing a negative ripple effect on other aspects of society. Not only would it lead to a loss of jobs that are created by the current healthcare system, but it would also reduce medical innovation, which has excelled the US because of our free market ingenuity. If you want healthcare to stop advancing instantly, just get rid of free market capitalism. The latter point addresses a somewhat fundamental issue with regards to healthcare. The services provided don't magically materialize. Rather, they are the result of research that consists of a lot of hard work and money. Part of the concern that some may have doesn't deal solely with access to healthcare. It also focuses on the more fundamental question of what healthcare treatments even exist as a result of medical discoveries. It's not simply a matter of giving people healthcare. It's also about continuing the progress that has been made in the medical field. This article seems to suggest that changing our healthcare system could have an unintended ripple effect on slowing down research that is needed to address many of the unanswered questions scientists have about diseases and how to treat them. The article then makes a final point about rationing. Since Sanders' proposal cannot provide an unlimited amount of health care, there would need to be a government entity that controls the claims and procedures to be approved or denied. For those who are skeptical of the government, or who are satisfied with their current health care, the thought of leaving these decisions up to a government entity may be scary. All in all, the article seems to aim at taking whatever impressions people derive from the phrase Medicare for All, as well as the idea that this healthcare would be free, and then lists a number of reasons for us to be skeptical of the proposal. In alignment with these ideas was another article, which referenced Seema Verma, who is the Centers of Medicare and Medicaid Services Administrator. In so doing, it appealed to what many would consider an authority on this matter. She describes Medicare for All as the biggest threat to the American healthcare system, which would involve stripping people of their private health insurance, forcing them into a government-run program. Such would be necessary since the Medicare for All plans, which have been proposed by both the Senate and the House, would abolish almost all private coverage. It's noted that supporters emphasize that healthcare should be a right to all, and, in spite of higher taxes, many would end up saving money on healthcare costs. With that said, Verma argues that socialized healthcare systems in other countries have problems of their own, including long wait times and poor care. One ripple effect of this is that it causes their citizens to travel to the U.S. for drugs and care they can't access at home. Not only does this claim point out flaws in socialized healthcare systems, but it appears to implicitly argue for the superiority of what the U.S. can provide. Claiming that people are leaving other countries and coming to the United States to get healthcare suggests that there is something our system can offer which theirs cannot. A political aspect was also noted as well. The article mentions that the plan has also seen skepticism from Democrats in Congress, with Nancy Pelosi suggesting that it may not be as good a benefit as the Affordable Care Act. She also questions how it will get paid for. Another article even suggested that Nancy Pelosi's office engaged in some questionable tactics to oppose Medicare for All. It's claimed that an advisor to House Speaker Nancy Pelosi reportedly urged health policy groups to raise their concerns about Medicare for All proposals, just as the plan was beginning to be embraced by top 2020 Democratic presidential hopefuls. The motive appears to be the concern that the push for the radical single-payer goal risks diverting from the party's main healthcare message. A private meeting of policy groups left some attendants with the impression that Democratic leadership wanted them to undermine Medicare for All. According to one person, it came across as, "We need this so we can get on with our agenda. Can you help us point out the problems?" However, a spokesman for Pelosi is quoted as saying that this type of a conclusion is misleading. This point may touch on the darker side of what goes on behind closed doors, and the unseen ways that politicians try to influence what policies are accepted and promoted. On a more general note, what all of this may reflect is a broader divide within the Democratic Party. As the article puts it, the revelation is likely to only fuel the division between the more centrist Democratic leadership and the growing far-left wing of Democratic freshmen, presidential candidates, and other lawmakers. Such is placed within a broader context of disagreement that has been brewing. For example, Pelosi has, in the past, expressed doubt about liberal proposals such as the Green New Deal, which she called Green Dream or whatever they call it, although she has since praised the enthusiasm behind the ambitious push to tackle income inequality and climate change. Another article likewise noted that Senator Chuck Schumer has become the latest Democrat to express skepticism over 2020 Democratic presidential candidate Bernie Sanders' Medicare for All plan, saying the Vermont senator's idea is just one of several proposals the party is considering to strengthen healthcare in the United States. More generally speaking, it's noted that Sanders' package is supported by many liberals and several other presidential contenders, but moderates fear it's an easy target for Republicans to characterize as a socialist path to huge tax increases. Later on, it notes that Republicans call Medicare for All Exhibit A in their own 2020 narrative, depicting a radicalized Democratic Party steering towards socialism. This reflects part of what goes on in the minds of some politicians when formulating policies. It's not solely about what will work. It's also about how a given policy can be critiqued by their opponents. In principle, it's possible for a good policy to be overlooked, in part because the current social norms allow critics to slander it and thereby prevent it from gathering a sufficient amount of support. With that said, it also appears as if Republicans have to deal with problems of their own. Karl Rove agreed with President Trump, who warned that the GOP needs to take up healthcare reform or risk getting clobbered. Rove notes that, "I've long argued the Republican Party needs to do a better job on healthcare. However, you have to have a plan, and the problem is the administration went out and said let's vote on it without having a plan. Healthcare is complicated, and you better have thought this thing through. Otherwise, you're not able to move forward. One suggestion is that Republicans can implement incremental improvements on the healthcare system that make sense to ordinary Americans. While criticizing Medicare for All is common amongst Republicans, it's also important for them to remember that many people are concerned with the current healthcare system, and they need to be strong advocates for policies of their own. Focusing too much on running negative campaigns may not give voters what they want to hear. One final aspect I'll mention was discussed in an article which focused on the scope of who will get covered by Medicare for All. It claims that the newly unveiled Medicare for All plan would open the door to giving healthcare to illegal immigrants, a marked left-wing departure from past proposals for healthcare reform. Technically, it does not speak directly about immigrants, but refers to covering U.S. residents instead. Two bills have been introduced, one in the House and the other in the Senate. Both would extend coverage to every U.S. resident, a shift from the Affordable Care Act, which limited benefits to citizens, nationals, and lawfully present immigrants. The House bill also prohibits the government from denying benefits because of citizenship status. Some quotes from Sanders suggest that his bill guarantees health care to every man, woman, and child in this country, and would cover every U.S. resident. This point highlights how seemingly unrelated topics may be intertwined with one another. Although the article doesn't discuss it, this point could potentially raise concerns about providing Medicare for all while simultaneously having poor border security. Such may provide an incentive for people to cross the southern border and exacerbate some of the issues we are experiencing down there. Articles from National Review also voice some criticisms of this approach towards healthcare. One, while noting that there are problems with the current system, goes on to raise a few key questions that proponents of Medicare for All must deal with. The first focuses on how much it will cost. The author seems to convey a degree of pessimistic uncertainty, claiming, "We don't yet know exactly how much Sanders' plan will cost, but the price is bound to be high." This is even more true for Sanders' most recent proposal, which will have even more costs than his previous one. The article also emphasizes the lack of specifics when it comes to paying for Medicare for All, claiming that, when it comes to paying for all these goodies, Sanders is exceedingly vague. Neither the legislation nor his summary includes a funding mechanism. While taxes are an option, and increased taxes will be offset by eliminating premiums and out-of-pocket expenses, the article suggests that most middle-income families will likely end up as net losers. It also brings up concerns about the ripple effect of this, as it notes the drag on economic growth and job creation that would result from taxing risk-taking and entrepreneurship. The second question asked, if you like your insurance, will you be allowed to keep your insurance? A critical response is given, with the author claiming that Sanders' plan would summarily kick every American off their current plan and dump them into the new government-run system, later adding that, at its heart, Sanders' plan is fundamentally anti-choice. It is a one-size-fits-all, government-knows-best concept. The third point brings up concerns about how doctors will get reimbursed for their medical care. Sanders' plan is set to cut their reimbursements 40%, which could lead some to leave the profession, giving rise to concerns about doctor shortages. Moreover, the price controls that lead to lower wages for doctors would also mean that research and development could be slowed or, in some cases, abandoned. That would mean fewer medical breakthroughs. Finally, a fourth concern deals with the jobs that would be lost by wiping out the entire insurance industry. While some may find new jobs as the government takes over healthcare, the author is skeptical that this would cover everyone who is currently employed by the insurance industry. This means that hundreds of thousands of others would likely have to find new work. When taken together, the article suggests that the matter is complicated, and making Medicare for All work without incurring negative side effects is a difficult task. Other articles have focused on the financial aspect of Medicare for All. One was published by the author of a widely covered research paper that emerged in 2018, which estimated how much Medicare for All would cost. It offers some insights into how the calculation was made and describes some of the assumptions that were present. Another article described these assumptions as generous, which means that the conclusion is more likely to underestimate the cost of Medicare for All. For example, he assumed that a Medicare for All program could pay doctors and hospitals at Medicare rates, even though these are more than 40% lower than those currently paid by private health insurance, and for most hospitals don't even cover the full costs of providing care. Another article argues that, in order for this assumption to make sense, we would have to force every doctor and hospital in America to accept Medicare reimbursement rates for all patients, while assuming that this would have absolutely no effect on their capacity or willingness to provide services. What all of this indicates is how challenging it can be to truly estimate what Medicare for all would cost, as well as the ripple effect this policy may have. On one hand, assumptions that produce a lower cost estimate may involve reimbursing hospitals and doctors less, which could, in turn, influence the quality or quantity of services provided. On the other hand, higher reimbursements may allow for sufficient services. However, this would lead to an estimated cost that is far higher. What this suggests is that a given cost estimate needs to be taken in a qualified sense. In other words, a given estimate is true if a number of other things are also true as well. Ensuring that all of these additional assumptions are valid is part of what makes this calculation somewhat challenging, and seems to inject a degree of uncertainty into it. With that said, there's another topic which received some unique attention by National Review. One article noted that a Medicare for All proposal that was released in February would mandate government coverage of abortions. It adds that, in plain language, the bill would guarantee free abortions for all women, which is to say abortion would be underwritten, along with everything else, by taxpayers. An additional concern is voiced later on. The Medicare for All legislation likely could be read to require hospitals and doctors to perform abortion procedures, at least if they already offer or are trained to provide reproductive health care of any kind. The article closes by saying that, requiring Americans to fund all abortions, and possibly requiring all healthcare providers to perform abortions, is just the next step down their increasingly radical path that treats the choice to kill an unborn human being as a fundamental human right. Statements like these illustrate how implementing certain healthcare policies can give rise to strong moral or religious disagreements over what counts as healthcare and whether people must be compelled to fund or provide what they see as unethical healthcare services. At Think Progress, a notably different angle was presented. One article offers a defense of universal healthcare while criticizing President Trump's comments on it. The article claims that President Donald Trump has been spreading a lot of misleading statements or flat-out lies about Medicare for all. Most recently, Trump said that providing health insurance to everybody doesn't work anywhere in the world. His statements are countered when the article notes that the reality is countries that prioritize universal health coverage by relying on the government to provide health care, as with single payer, have better health outcomes while spending less than the U.S. It also addresses the claim that people, such as those living in Canada, leave their country in order to receive medical care somewhere else. According to the article, as for Canada, Trump assumes a lot of its residents flock to the U.S. for care, but less than 2% of Canadians traveled outside the country for medical care in 2016. The positive portrayal of Medicare for All continued in another article, which claims that a study found that a single-payer Medicare for All system would reduce the amount the U.S. spends on health care by more than $2 trillion. It later notes how the study concludes that Medicare for All would result in significant savings for the country because of lower prescription drug costs, saving $846 billion over the next decade. Streamlined administrative costs under the plan would save another $1.6 trillion. In addition to discussing these savings, the article also points out the significance of how we view the cost of Medicare for All. It notes that it's important to discuss the costs in the context of what the U.S. already spends on healthcare. The point seems to be that we shouldn't merely look at the price tag of Medicare for All in isolation. Instead, it's important to also consider what would be spent on healthcare given the current state of affairs. This comparison can be useful when assessing which approach may be more cost-effective. It's also important to keep in mind what Medicare for All would offer. The article notes that harping on the costs of the plan without discussing its benefits is a favorite tactic of the right, but centrist Democrats have a history of falling into the same trap. Although people talk about its cost, what no one seems to mention is what that money is paying for. This point illustrates how, when describing a policy, it's important not to neglect some aspects while overemphasizing others. Doing so can produce a skewed understanding of what's actually going on. This implies that, when assessing a given proposal, it's important for us to make an effort to evaluate it in its totality, and not solely, or even primarily, focus on aspects which may be viewed as either positive or negative. After noting a number of positive aspects in Sanders' Medicare for All plan, the issue of why there is opposition from Democrats is touched upon. The article claims that the resistance to single-payer, especially among establishment Democrats, is really just resistance to changing the status quo. This raises a more general question that should cause us to reflect upon why we hold the views that we do. It can be easy to uncritically accept the current system to the point that we become resistant to change, even if evidence suggests that alternatives may provide benefits that the current system lacks. At the same time, we should be careful not to simply accept any new idea that comes our way, even if it claims to stand for and promote what is good. After all, just because it looks good on paper doesn't necessarily mean it will be good in practice. A balance of open-mindedness, coupled with a healthy dose of skepticism, may be a more desirable approach. However, what that actually means in practice is likely to differ from person to person. Another article focused on a unique aspect of Medicare for All's coverage. The article asks whether Medicare for All really includes everybody, then goes on to claim that disability rights activists say not really, if you're basing it on the way Medicare, the health program for seniors and certain people with disabilities, works today. The article then goes on to discuss the needs of people who live with disabilities. Advocates are doing their best to make sure that the needs of this community are not left behind. Success was seen in two major bills, the Medicare for All Act of 2019 and the Medicare for America Act. Both offered long-term service and supports, which encompass a lot of medical services for someone who has difficulty completing daily tasks because of disability or aging. Focusing on the details of this policy is important, since, according to the article, at the present moment, the system is failing the community much of the time. This can be addressed by properly defining what it means to have a disability, not turning away people with pre-existing conditions, and to offering long-term services and supports, something which the Affordable Care Act tried to address, but was ultimately unable to do. This point is one that appears to have been covered differently by other outlets. For example, a Fox News article claimed that Bernie Sanders found a way to expand his proposal even more to the left, adding later that it would encompass not only all healthcare and prescription drugs, but also dental, vision, and long-term care. Likewise, National Review notes that Sanders' plan will now cover long-term care, which had been omitted from previous bills. Both these articles seem to mention long-term care briefly, and then go on to discuss the costs of the bill. Such is quite different from the article by Think Progress, which described the details of what gets included in Medicare for All as literally life and death for the disabled community. The article also includes some of the specific struggles that people within this community face when trying to get health care. The article also includes some of the specific struggles that people within this community face when trying to get health care. Part of what this gets at is how important it is to remember that real people will be influenced by these policies. While people can have disagreements about what they think is best, it's worthwhile to be aware that, even if one is critiquing a policy, one should simultaneously be mindful of who that policy is aimed at helping and what challenges those people are facing. Think Progress also discussed some of the difficulties that Medicare for All faces. Some opposition, unsurprisingly, comes from Republicans. It describes those who made the same general dishonest claims, suggesting that Medicare expansion would destroy Medicare as we know it and rob millions of their health care coverage by providing them with coverage. Another article claims that Republicans have gone all out to try and discredit the popular health care proposal in advance of next week's midterm elections. They are also described as falsely claiming that universal health coverage to more Americans would harm those who are already fortunate enough to have health coverage, running ads that imply Medicare for All would kill senior citizens and just flat out lying about their history on health care as a party. Opposition also appears to be coming from Democrats who may be influenced by special interest groups. One article claims that Medicare for All has attracted widespread support in the Democratic Party, but the ambitious overhaul of the nation's healthcare system faces a major threat: big spending by healthcare and insurance interests determined to preserve the status quo. The article goes on to outline a handful of Democrats who received donations from the Partnership for America's Healthcare Future, a coalition formed by leading pharmaceutical, insurance, and hospital interests to curb the favor for Medicare for All in the Democratic Party. The challenge this poses is outlined by Bernie Sanders, who claims, "This is not going to be an easy fight. You're taking on the drug companies, you're taking on the insurance companies, and these people have unlimited amounts of money. Unlimited. They buy and sell politicians every single day." Adam Gaffney, the president of a single-payer advocacy group, also claimed that, "We know for a fact that corporate opposition to Medicare for All has deep pockets, and they wouldn't be giving this money to Congress if they didn't think it would have its desired effect. It should raise people's skepticism about the motivations of leaders." A similar article also discussed opposition from the healthcare industry against healthcare proposals. Although the main focus of this article wasn't on Medicare for All, it discussed a bill that would allow people to buy into Medicare beginning at age 50. Yet, it immediately noted that already major players in the healthcare industry are coming out against it. Later on it adds that the fact that the organization called the Partnership for America's Healthcare Future opposes this bill goes to illustrate that major players in the healthcare industry will fight against even marginal reform that will disrupt the profits they gain under the current system. Another topic that was covered by Think Progress dealt with abortion. Although the main focus of these articles didn't seem to be Medicare for All, it's at least worth comparing some of the points they made with the article by National Review. If you recall, that article focused on how Medicare for All would require people to fund abortions and could potentially force healthcare providers to perform them, whereas such focuses on who will have to pay for abortions and who will conduct the actual procedure. Think Progress placed an emphasis on those who will be impacted by policies which use federal money to pay for abortion. One article notes that activists have underscored that this is an equity issue because people with lower socioeconomic status are the ones actually impacted by anti-abortion measures. Another notes that, now, instead of simply defending the right to abortion, reproductive rights advocates are talking about securing access. It also quotes someone claiming that excluding abortion services from any federal plans interferes with reproductive health decisions and ultimately disproportionately affects low-income people and people of color. The article also offers reasons for why advocates need to secure abortion coverage in any healthcare plan, whether it's offered in Medicaid or in a single-payer healthcare program. This, it is suggested, must be done explicitly, because abortion isn't always what comes to mind when people think about expanding healthcare. It's claimed that, unless you are explicit, abortion ends up on the chopping blocks. These articles outline the importance of letting abortion get funded by federal funds, as would be the case with Medicare for All, such as portrayed as ensuring that those who need the procedure most will be able to access it. This brief overview brought up a handful of different topics, such as how much Medicare for All will cost, how it will get paid for, and the ripple effect of implementing such a policy. Although a lot more could be said on the matter, I'll highlight a handful of points worth considering. One point to be aware of is the language that is used to describe Medicare for All. Such can have a large influence on how it's perceived. In general, conservative outlets are more likely to emphasize how Medicare for All will, for the most part, eliminate private insurance, such as led them to brand it as anti-choice and portray it as the government imposing what it thinks is best upon us. When describing the impact of taxes on the middle class, Fox News said that this group would suffer, emphasizing the negative impact that it would have on this population. When criticisms like this are made, it's worthwhile to consider alternative perspectives. For example, while some people may be frustrated by paying higher taxes, there may be others in the middle class who are willing to make that trade-off. To claim that this group will suffer may be an inaccurate overgeneralization. Likewise, while there's a sense in which Medicare for All is anti-choice if it gets rid of private insurance options, one may also want to consider things from the perspective of someone who doesn't have health insurance. From their viewpoint, it may not be a matter of having numerous private insurance options versus one government option. Rather, it's between having no private insurance or having government-provided insurance. The main point here is that news outlets may describe policies in a way that paint a particular perspective, whether positive or negative. Perhaps these perspectives are true, or at least have some degree of truth in them. However, at the same time, it's at least worthwhile to assess other ways of looking at the situation, which may offer some insights into why people disagree. There's also the issue of how the policy gets portrayed or perceived versus what it's actually like. An article by Slate notes that Medicare for All is a popular and politically effective slogan. Polls have shown that 70% of adults, and maybe even more, say they'd support opening the federal health care program for the elderly to every American. Yet, it goes on to say that one problem for Sanders is that when most Americans hear the words Medicare for All, they aren't necessarily imagining the sort of single-payer system the Vermont senator has proposed. Worse yet, support for national health insurance seems to vacillate a great deal based on how pollsters couch the question. Another article by Reason claims that a new poll shows that the clear majority of Americans support Medicare for All until they are told what it is and how it will work. Although the results of surveys like these may be up for debate, they at least suggest that the phrase Medicare for All may not necessarily give people an accurate idea of what the policy contains. Part of the difficulty is that the phrase can mean different things. Vox notes that, historically, Medicare for All has meant single-payer health insurance, a national government-run program that covered every American and replaced private coverage entirely, similar to the government-run health care programs in Canada and some European countries. Yet it adds that, these days, other plans are falling under the Medicare for All umbrella. Another point centers on what the plan would cost. Part of this depends upon what plan we are talking about, as well as what study we are looking at. One particular analysis that received a lot of attention was done by the Mercatus Center, which is described, at least by some, as libertarian or right-leaning. Many claim that this, as well as the funding it receives, would tend to bias it towards opposing Medicare for All. Nevertheless, one article notes that a report that was supposed to discredit the single-payer solution found that, even after the benefits of a Medicare for All program are realized, the potential cost of the plan would still be less than the potential savings. What this translates to is that, under a single-payer system, Americans would get more quality care for more people at less cost. With that said, the alleged savings are not noted by an article on Breitbart. Instead, the price of $32 trillion is emphasized, as well as how it would require historic tax increases to pay for it. It also notes that the estimates for the $32 trillion price tag are relatively conservative, implying that the plan may actually cost much more. While getting into the details of how these estimates are produced is beyond the scope of this video, it's at least worthwhile to be aware that making this calculation depends on a number of assumptions, such as how much doctors will get paid, how much healthcare services people will use, how much prescription drugs cost, and how much will be spent on administrative costs. Any calculation must accurately assess these components if its conclusion is going to be accurate. This can be a somewhat challenging task. As the New York Times puts it, any Medicare for All system would be influenced by the decisions and actions of parties concerned, patients, healthcare providers, and political actors, in complex, hard-to-predict ways. In addition to uncertainty over how much it will cost, there also appear to be some lingering questions about how it will get paid for. Some have noted that Bernie Sanders' plan goes into great detail about the type of coverage Americans would receive, but it provides significantly less detail about how it would finance such a generous healthcare system. Instead, Sanders released a 5-page paper that included a list of financing options. A similar point was made about a Medicare for All bill proposed by Pramila Jayapal, with Vox saying, "But where the Jayapal plan has great detail into what is covered, it does not get into a crucial question, how the government will pay for the new healthcare program." A series of other issues deal with Medicare for All's overall impact. Some raise concerns that there may be unintended consequences which should cause us to second-guess the policy, in spite of how good it may sound. One that arose dealt with the number of healthcare workers who would be available to work. Some have claimed that Medicare for All could worsen the doctor shortage. The implication of this is that there will not be enough workers to provide the health care that the government guarantees as a right, thereby causing patients to suffer. The general concern about doctor shortages isn't merely hypothetical. In the government-run British healthcare system, known as the National Health Service, many have reported on a doctor shortage, which is expected to worsen. Yet, although some doctors disapprove of a single-payer system with large government involvement, it seems like sentiments are changing, especially among younger physicians. When assessing this point, it may be worthwhile to be aware of a distinction between guaranteeing universal healthcare as a right and actually being able to access healthcare. An obvious example can be seen in Venezuela, which has free healthcare guaranteed to all in its constitution, and yet, the current state of the system appears to be very poor, and healthcare appears to be deteriorating. The point here is not to say that the problems facing the NHS or Venezuela will necessarily happen were the US to adopt a similar healthcare system. Instead, it's to emphasize that simply guaranteeing healthcare doesn't automatically mean it will happen. Another topic deals with the claim that people come to the US in order to get healthcare. For example, Donald Trump claimed that Canadians, when they need a big operation, when something happens, they come into the United States in many cases because their system is so slow. It's catastrophic in certain ways. Likewise, US News and World Report claims that, frustrated by long waits, some Canadians are heading to the US for medical treatment. Later on, the article notes that the public healthcare system sends some Canadians abroad for treatment, partly because of a lack of available resources. With that said, Vox reported that the best available research shows it's simply not true. Canadians are not fleeing en masse to the US seeking medical care, as it goes on to cite research which concluded that this rarely happened. Moreover, other articles point out that people in the United States also go to other countries for medical care as well. As one article puts it, healthcare has become so expensive in the United States that a growing number of Americans and their employers are finding it more efficient to fly across the globe for certain medical procedures. The savings are so great and the quality high enough that a handful of American insurance companies are now encouraging the practice and covering the travel and treatment costs. What this indicates is that, although some people find the US's healthcare services to be beneficial when compared to those in their own country, the overall picture seems to be a bit more complicated. Concerns also arise over the impact of Medicare for All on wait times. One article claims that long waits for care are endemic to government-run single-payer systems like the NHS. Yet, some US lawmakers want to import that model from across the pond. That would be a massive blunder. Similarly, The Guardian notes that record numbers of patients are not getting vital cancer care on time. Hospitals are increasingly having to force patients to wait for care because they cannot keep up with the growing number being referred. With that said, others paint the concern over wait times as less problematic than some may think, as was seen in an article by Fact Check which compared healthcare in the US to Canada. It claims that wait times for physician appointments and non-emergency surgery tend to be longer in Canada, which has a government-funded universal healthcare system, than in the United States. However, it goes on to note that, on most measures of patient-reported physician quality, Canada comes out slightly ahead of the US. This produced the general conclusion that wait times are longer in Canada, but health and doctor quality don't seem to suffer. Similar disagreements can arise when discussing the impact of Medicare for All on the quality of care, its impact on medical innovation, the impact that increased taxes will have on economic growth, the effect of the policy on the national debt, and so on. On top of all this, there are also going to be disagreements about ethical issues, especially those dealing with abortion. Moreover, there are more general concerns about the corrupt influence that money can have on politics, and the role that industries who have a vested interest in healthcare policy have on what policies get implemented. Taken together, what all of this suggests is that the topic of healthcare in the US is complicated. With that said, I find virtually no disagreement over two things. First, that increasing access to healthcare is important, and second, that there are some changes which need to be made. The controversy emerges when people begin to discuss what changes we should implement and what the ripple effect of these policies will be. One final point that I want to make is to emphasize that healthcare policy is extremely personal. Think Progress appeared to highlight this point, especially when discussing why some people think it's important for long-term care to be included in Medicare for all. Regardless of what perspective people take on what changes need to be made to our healthcare system, we need to remember that people are suffering and the decisions we make have the potential to help them or not. Although discussions on this topic can be overwhelming, given the complexity of the issue, it's vital to bear in mind that we are talking about real people who are facing extremely difficult challenges and whose lives matter. Whatever policy we support, or whatever solution we pursue, it's always important to keep those who are sick and most vulnerable in mind. With that said, thank you for listening, and goodbye.